the recent national strike by doctors occurred despite our fulfillment of all their demands. The medics participated in the strike in solidarity with their peers. I wish to underline that the medics, specifically our medics, participated in the strike because they were in solidarity with their peers. The resultant financial impact of this amounted to well over 77,554,679 shillings for the 182 medical officers, pharmacists, and dentists, and 261 clinical officers during the 56-day period. This was a time when it must be observed that as a county, we were in complete compliance with all the issues that the medics had raised. So as a county, we were in full compliance with the concerns that the medics had raised. It is worth noting that Machakos County has a workforce of over 7,300 staff. Once again, it is worth noting that promotions have not been effected for some time. Indeed, with some employees accumulating up to 15 years in service without advancement. There have been promotions of healthcare professionals conducted in years 2021, 2022, and 2023. Ladies and gentlemen, for avoidance of doubt, I want to repeat that again, that some of our members of staff have gone for quite a long period of time without any promotion. But for the last 3 years, we have consistently promoted members within our healthcare. This has given rise to anxiety among other staff members. To avert further apprehension, the county management is actively reviewing promotions for the remaining employees. Eligible staff have been requested to submit their documents for processing in lieu of promotions down the line. Let me note that currently our wage bill as a county stands at 44%, and this is after a reduction from 49%. This percentage surpasses the legal limit by the legal limit of 35% by 9%. Any further increases to this wage bill could exacerbate or worsen our financial challenges. Notably, the health sector alone accounts for 53% of the county's wage bill, which constitutes over 52% of total expenditures, leaving only 47% for the remaining 9 departments. I want to repeat that once again for the sake of clarity. One department, the healthcare department, consumes about 53% of our budget. The remaining 9 departments take up the remaining 47%. In 2023, Machakos County successfully promoted over 420 healthcare officials. It had been agreed that promotion arrears will be disbursed over 5 months from the month of August 2024, and this would be at a cost of 20 million per month. Ladies and gentlemen, this has been implemented since August this year, dutifully.
We are considering that as a loss because they never worked for over 50 days. And when they came back, the county government paid them full salaries for the days they never worked. The reason that we paid was caused by an agreement, the one we call return to work formula. Therefore, it was agreed as they come back to work, they should be paid. Now the county government is concerned that anybody going for what we are calling go slow or has tried thinks that he will be paid when he comes back. That will not happen. If anybody leaves his work position and goes out of work, then the position of the county government of Machakos, together with the county public service board, is that we shall not pay if you have not worked. That is one position.
We wish to give a media briefing, and with me is where public service is domiciled. We have officers in. We have the chairman, county public service board, for purposes of making this media briefing. Concerns about staff promotions within the county government. Now, in order that we may put certain perspectives correctly, we found it necessary that we do this media briefing. And I will start by reading this statement here from the Office of the County Secretary and Head of Public Service. And it is titled Machakos County Addresses Promotion Concerns by Medical Staff. The government
question.
Just before we go to question. Ninawetaka na miaka nela ibetite itatu nitwithitwe na pro.
There was reports.
Sorry, thank you. Medical officers in Machakos implementation of some agreement that we need to look up to. What is your message to
the strike that our medical officers went in support of their colleagues, hence their grievances have been met.
Let me invite the...
I have been on the ground na nimeona baadhi ya wagonjwa wakirudishwa nyumbani kwa sababu ya mgomo wa madaktari. Swali langu ni je, kama mnafutilia mbali mgomo, mbona hawa officials hawako hapa? I am asking you, if you are giving this pressure, why is it that the officials of the Doctors Union and KVU are not here?